Concussion is a temporary energy deficit that lasts for 3 to 6 weeks. The number one predictor of a short recovery is actually being seen by a healthcare provider that is knowledgeable in concussion care and then starting treatment as soon as possible.
Okay. I think you bring up a good point. You said it, emergency medicine is really more about stabilization, right? And providing that immediate care for those life-threatening situations. And I completely appreciate that this would probably be the ideal time to really lay that groundwork for ensuring that effective long-term concussion treatment through that education, right? That the patient on what to look for in the coming weeks and months. So to that, when they leave the ED, usually there's a follow-up. They tell you to follow up with your primary care physician in a few days. What would you tell your patient to look for at that visit?
Well, I want to go back to something that you just said, and I do agree with you. I will tell you that I gave an in-service to some of the emergency room doctors at Piedmont a year or so ago, and we actually started getting people come to our office expecting to exercise, and that made it so much easier. The person was ready, was motivated and ready to go, and those people did really well. When they get told to rest, and then I go and I tell them to exercise, it causes a lot of confusion. So starting this whole idea about exercise early makes a big difference. But in the primary care office, again, these folks like I often do get and can get anti-CGRP medications as samples. So if headache is a big problem, I recommend they start using some of the CGRP drugs because they're just so safe. Okay.